Hi, I'm Dr. Russ VanderWilde. The goal of this video is to make your day of surgery as smooth as possible. Today we're going to cover pain management, wound care, your exercises, and the use of either a sling or a brace. I hope you find this information useful, and good luck with your upcoming procedure.
On the day of your procedure, you'll have another chance to have your questions answered by your physician. And if you can think of anything else between now and then, just go ahead and make a list of those questions and we'll get them answered before we go ahead with your procedure. On the day of the procedure, you will also have both the surgical site and the type of procedure confirmed, and the site of the surgery will be marked with a permanent marker. This should give you confidence that the correct site, the correct extremity, and the correct procedure will be performed. The final issue is that the anesthesia team will meet with you on the day of surgery to talk about your options for anesthesia as well as the risks. For many of the procedures that are performed as outpatient, surgical blocks will be an option, and we would strongly encourage you to consider this if it is an option for your procedure, as it would greatly decrease the requirements for anesthesia. It would also facilitate your post-operative pain management and help speed up your recovery time. For post-op pain management, we often use a combination of two medications to provide early post-operative pain control. The two common narcotic medicines that we use for short-acting, rapid-onset pain management are either Percocet or Vicodin. These medications can be taken as either 1 or 2 pills every 3 to 4 hours as needed to control your pain. The side effects can include some sedation and some constipation. The other medication we find useful in addition to Percocet and Vicodin is Benadryl. Benadryl, or diphenhydramine, is an antihistamine that has a potentiator effect on whatever narcotics are in your system. Benadryl can be taken every 6 hours as needed to increase the effectiveness of your pain medication. On its own, it has no painkiller effect and is useful only when there's narcotics in your system. As an example, if you took a Percocet 2 hours ago and now you take Benadryl because you're not getting good pain control, the Benadryl will increase the potency of that Percocet for the remaining 2 hours that it's in your system. Benadryl has another effect, and that is it does have a slight anti-nausea effect that can be beneficial if you're having post-operative nausea, and can be taken every 6 hours for post-op nausea control. Most times after your surgery, your wound will be covered with a bulky dressing. This bulky dressing in the case of a shoulder will be held on by foam tape, and in the case of a knee will be held on by a compression wrapping. After 48 hours, we recommend that you remove the dressing and that the arthroscopy portals, which are the small incisions, be covered with a Band-Aid. If you have any larger incisions, we recommend that these be covered with a dry gauze and tape. When your incisions are dry and there's no drainage for 24 hours, at that point, it becomes safe for you to shower. Now, to clarify, you will change the dressings at 48 hours, but we would like you to wait 24 hours after that dressing changed to ensure that you don't have any drainage from the incision areas before you shower. When you do shower, we recommend that you avoid immersion in the water, like going into a regular bath or hot tub. It's okay for shower water to hit the incision area, but we would like you to just dab things dry with a towel. Not aggressively rub or scrub the area, and then after each shower, reapply a new set of Band-Aids over the incision and a new gauze over any larger incision areas. The signs of an infection would include redness, fever, or chills, or any kind of drainage other than clear liquid, clear yellow fluid, or blood. Clear yellow fluid or blood are very common after arthroscopy and should not be a concern. If you have any fever, chills, or drainage that appear to be purulent, thick, yellow, or pus, we should hear from you. That way we can address this before it becomes a bigger issue. Ice can be a very potent natural anti-inflammatory and should be thought of as being one of your biggest tools for post-operative pain management and a way to easily and safely decrease swelling and pain. Icing can be difficult, and the commercially available gel packs or pumps can be a big tool to help with that. If you find you don't have commercially available gel packs, unpopped popcorn can be a very safe and easy alternative. We do recommend that you use a thin pillowcase or small absorbent thin layer to prevent condensation in the area of the surgical incision. By doing this, you can also provide a thin layer to avoid frostbite. After your surgery, we would recommend that you sleep in a semi-reclined position very similar to sitting in a lounge chair at a beach. A lazy boy or recliner is a good way to accomplish this position. It provides support to the shoulder. It puts you in a position where you are elevated to decrease swelling, and it can be very beneficial to facilitate sleep for the first several weeks after your surgery. If you don't have access to a lazy boy or an easy chair, then we recommend that you prop yourself up on the couch using the edge of the couch to protect and cradle the shoulder, as well as pillows to obtain that kind of beach chair or lounge position. At your last clinic appointment, you'll be provided with a sheet of postoperative exercises. It's important that you review these before your surgery so you're familiar with them and can perform them during the postoperative recovery. The first exercise is simply moving your hand in a squeezing motion. It is often facilitated by use of a tennis ball or a foam ball that can be incorporated into your sling. By working on early range of motion, you decrease swelling, increase the circulation of the extremity, and will facilitate both your postoperative pain management and your early recovery. The other exercises are to be started the morning after surgery, and these include a dangling pendulum exercise or Codman's pendulum exercise. The Codman's pendulum exercise is performed by bending at the waist and removing the sling to allow your arm to dangle. We find it most useful to think about drawing circles on the ground by swinging your arm and using the momentum of the arm rather than muscle contraction to achieve a circular motion. We recommend doing this 3 times a day, 10 rotations in each direction to provide shoulder motion to decrease stiffness without stressing your surgical repair area. The second exercise is commonly called the table walk or an active forward flexion exercise. This also is performed with your arm out of the sling. It is usually best to sit next to a table, and with your operative extremity on the table, you can both pull the arm forward and push your body back to facilitate forward flexion or bringing your arm into an overhead position. The goal of this table walk is to place your ear on the table, but this will be difficult to accomplish early on. This goal often takes 2 weeks to accomplish, and more than anything, what we want to see is that each day you make a little bit of progress so that you're getting closer and closer to achieving the overhand position of your arm with the table walk exercise. With your shoulder surgery, you will be given one of 2 different sling options. One is called a simple sling, which is a Velcro strap that goes across the shoulder and attaches to a cradle that supports the arm. This sling will be required while your block resolves. Once your block resolves, you should feel free to loosen and reposition the arm, and in most cases, this sling is recommended for a period of 10 to 14 days after surgery and is gradually discontinued. The second type of sling is called a Remedy 2 sling. The Remedy 2 sling incorporates a small pillow attached to a waist strap, and in some larger individuals, a second strap over the top of the shoulder. This provides a more secure form of immobilization. Like the regular sling, this sling is worn full-time until you start your post-operative exercises. At that point, the sling can be removed to do your exercises and can also be removed to shower. We recommend that you allow your arm to hang at your side while you shower and that the arm be dried. You get back into the sling and then pat the incision areas dry and then change the Band-Aids as part of your post-operative showering routine.
Hello again. We hope this video smooths your day of surgery experience. As your day of surgery approaches, I hope you'll keep a list of questions, and remember, the only bad question is the one that you forget to ask. Thank you for allowing us to participate in your care.